Assalamu alaikum. On behalf of Ahsan Academy, let me welcome you to a presentation on the arteries of the neck. Let us face the objective. We'll discuss here the origin of the large arteries from the heart, the arteries proceeding to head and neck region, and artery supply of the neck, and the structures of the head, the outer structures, not the brain, and the artery proceeding to vein. Only will mention the name. So heart is labeled here. It is in the central part of the inferior mediastinum. The great vessels are arising, arteries are arising from here. The first I'm showing is the ascending aorta that arises from the left ventricle. It ascends and become arch of the aorta. The arch of the aorta, from its convexity, gives three branches. From the left side, this is the left subclavian artery, then the left common carotid artery, you can see the labeling, and on the right side a single artery arises from the convex surface, and this is known as brachiocephalic trunk, who divides into the common carotid and subclavian. So these are known as right common carotid and right subclavian. So you can see this branching pattern of the great vessel, great artery. This is the arch of the aorta labeled here on the left figure. You can identify this is the brachiocephalic trunk and divided into common carotid and subclavian of the right side, and this is the left side, common carotid and subclavian. So these are proceeding towards the neck and upper limb. So this head and neck region is supplied by these two branches of these two common carotid arteries. It's totally going to the neck, and you see this is the subclavian. It is primarily going to the upper limb but gives branch to the neck. So the artery branches from the subclavian artery. So head and neck region is supplied by the common carotid artery totally, and some branches going to the neck from the subclavian artery. So this one is the large artery on the right side. This is the brachiocephalic trunk, you can see, and arch of the aorta or brachiocephalic trunk directly gives the artery. Those are the common carotid artery. This common carotid artery at the level of the upper border of the thyroid cartilage divides into internal and external carotid artery, and this is the place where it divides. So common carotid artery arises on the right side and left side in a different way. The right side, you can see in the figure, it is arising from the brachiocephalic trunk. It is actually one of the terminal branches of brachiocephalic artery or trunk. So this division takes place behind the sternoclavicular joint of the right side. On the left side, this you can see, this is the sternoclavicular joint. Behind that, the division occurs, and common carotid artery and the subclavian originates here in the behind this joint. On the left side, it arises from the arch of the aorta in the superior mediastinum, passes vertically and to the left and crosses the joint, the sternoclavicular joint of the left side, to become the structure of the neck. You can see the dotted line for the left common carotid artery on the right figure. Here, common carotid artery is labeled. On the left figure, it is underhidden of sternocleidomastoid, but the sternocleidomastoid muscle and other muscles are clean, dissected to show the total course of the common carotid artery. So it runs upwards from the sternoclavicular joint, behind the sternoclavicular joint, up to that level we have already discussed. So from here it ascends up and laterally. It is it lies in the carotid sheath, and it runs upwards first behind the sternocleidomastoid muscle, anterior border, and then it is exposed to the superficial and deep fascia and the skin. You can see the white dotted line. This part remains hidden under the cover of the muscle, primarily the sternocleidomastoid muscle. At the level of the upper border of the thyroid cartilage, this artery divides into external carotid and internal carotid artery. Internal carotid artery proceeds in the uh, carotid sheath, but external carotid artery exists from the anterior part of the carotid sheath. So up to the upper border of the thyroid cartilage, which is at the level of the cervical 4 and 5th, so third and fourth intervertebral disc. You can see the label here on the left figure. So the important aspects in the course is the sternoclavicular joint. Behind this, both the common carotid artery lies. On left side, it arises from the aorta, crosses this point, and on the right side, this is the origin. It remains within the carotid sheath, total course. You can see the section, the artery is visible, section of the artery is visible, internal jugular vein and vagus nerve together. This is in a deep fascial sheath. This is the carotid sheath. You cannot see the course because of the sternocleidomastoid, and it runs up to the upper border of the thyroid cartilage. These are all important because this helps a doctor to feel the pulse of this common carotid artery. You will see as under the slide clinical significance. How does it terminate? That's an important thing because it makes a dilatation at its terminal part. This is known as carotid sinus. This carotid sinus is present in the terminal part of the common carotid artery. The labeling is shown, and the beginning of the internal carotid artery. So it extends at the junction of this one, means at the termination point of the common carotid artery. This is related to the blood pressure control. Common carotid artery, I was must give any branch. We usually used to say this one, but it is giving branch at the terminal part. So except two terminal branches. So if we want to say no branch, that will mislead. That may mislead. It has branch that is at the terminal end, so we can say in a different way. We should not say no branch. We can say this has two terminal branches only. So common carotid artery has two terminal branches at the end, no other branches during its course. External carotid artery is the branch of common carotid artery. So already it is clear that the branching takes place at the upper border of the thyroid cartilage, at the level of the intervertebral disc between cervical 3 and 4. You can see the common carotid and external carotid labeled here. And this is the thyroid cartilage. So upper border of the thyroid cartilage you can imagine, and you can see the bifurcation point. So upper border is an important landmark which will say you the termination of the common carotid, origin of the external carotid, and origin of the internal carotid. We can mark this on the surface. We can mark the thyroid position of the thyroid cartilage, and also we can draw the artery on the surface. external carotid artery, it emerges from the covering of the sternocleidomastoid muscle and can be palpable near the anterior border of the sternocleidomastoid. You can see this. This is actually under cover of the sternocleidomastoid. To explain, the artery is drawn over the area, over all muscles. Even common carotid, you can see the on the face. This is actually making a surface projection over the muscle. At first, it lies medial to the internal carotid artery. You can see the relation and anteriorly, and then it goes ascends up in the neck and become lateral to the internal carotid artery and moves back. It enters into the parotid gland. Already we know the parotid gland in other presentation. External carotid artery is one of the content of the parotid gland up to the termination of the artery. This dissected photograph is taken to show the branching pattern of the external carotid artery. External carotid artery have several sets of branching, the anterior set, posterior set, and maybe one medial set and terminal branches. So let me label it anteriorly, the anterior set. This is the thyroid, superior thyroid artery. This is the lingual artery supplying the tongue. Superior thyroid artery supplies the thyroid gland, and this is the facial. It's distributed in the face, muscles and structures of the face. Now this is the ascending pharyngeal. This may be the medial branch or posterior branch. Other two, this is occipital and posterior auricular, are the posterior branches. This is the terminal branch. This terminal branch is formed within the parotid gland behind the neck of the mandible. This is divides into maxillary artery and superficial temporal artery. So you can divide the or classify the branching pattern as anterior, medial, and posterior, and terminal. A diagram showing the left figure showing the parotid gland position. This is the termination within the parotid gland, and the termination is shown in a dissected diagram, and it divides into maxillary artery and the superficial temporal. Maxillary is relatively larger and going inside. Superficial temporal ascends up, and this division point lies within the parotid gland just in front of the neck of the mandible. So external carotid artery extends between the upper border of the thyroid cartilage to the neck of the mandible. This is the parotid gland shown. You can see the photograph of the total course. This is the mandible, and arrow indicate neck of the mandible position. It's behind the neck of the mandible, divides into maxillary and superficial temporal. Which artery supplying the scalp? You can see this is the superficial temporal. So superficial temporal is going to the scalp and supplying the side of the scalp up to the vertex, and at the level of the vertex there is anastomosis. This from the posterior part, this posterior auricular and occipital goes and supplies the posterior part of the scalp. So these are the branches of external carotid artery, already we know. But the anterior part, these supraorbital and supratrochlear arteries are arising from inside the cranial cavity. These are the branch of internal carotid artery and is coming out through the orbit and supplying the forehead region and the anterior part of the scalp. So internal carotid artery, we already understand the place of origin. This is arising at the level of the upper border of the thyroid cartilage, and this is the termination point of the common carotid artery, and it ascends in the neck within the carotid sheath. You can see the accompanying internal jugular vein on either side in the right figure and on the left figure. This vagus nerve is within the carotid sheath. So carotid sheath actually contains the common carotid and internal carotid, then internal jugular vein and the vagus. So this is actually in the line of common carotid artery. It lies, it doesn't enter into the parotid gland, it lies deep to the parotid salivary gland. You can see the photographs diagram actually is showing more natural diagram showing the course that internal carotid artery follow to enter the cranial cavity. It passes through the carotid canal. The base of the skull, shown in the lower two figures, the left one is viewed from the inferior, and the right one is viewed from above, and the cranial fossa are clear. So the left figure of the skull, the base of the skull, showing the arrow is showing the entry point of the carotid canal, and this carotid canal doesn't directly enter into the fossa. It enters into the part of laceration, foramen lacerum, and then via the foramen lacerum it is connected to the middle cranial fossa. So you can see this is the on the right figure, this is the carotid canal. It's a zigzag course, and the left figure, it is the entry point of the carotid canal through the foramen lacerum, and you can see the artery running in the carotid canal. The zigzag course you can identify. The subclavian artery, you can see here, is going to the upper limb mostly as a scarped course. This gives branched thyrocervical trunk, and from there branches passes to the neck region, inferior thyroid, transverse cervical. These two are supplying totally to the neck structures. It is costrocervical trunk, and this is also giving branch to the neck, deep cervical branch, and superior intercostal artery going to the chest wall. The most important artery arising from here for the cranial cavity is the vertebral artery. It passes through the neck, so we should try to discuss this one here. You can see the diagram showing the vertebral artery. Here we'll describe the course and origin. This is the subclavian artery giving branch the vertebral artery. So vertebral artery arises from the subclavian artery. It passes up and enters into the foramen in the transverse process, also known as foramen transversarium of sixth cervical. So seventh is spared. It enters into the sixth transverse process and foramen transversarium, then ascends up through these foramens up to the first one. So passes through all the foramens except the 7 and exits up through the atlas, transverse foramen of the atlas. So after exiting, the artery lies on the posterior arch of the atlas, making a groove. You'll see this is the carving over the posterior arch and makes a groove. So if we examine the atlas, we'll see the posterior arch and superior surface has vertebral arterial groove, and that groove also contains a nerve that is a branch of the first cervical nerve. This is the atlanto-occipital membrane. So this artery curves and passes through a small foramen in this membrane, this atlanto-occipital membrane. You can see here this arrow is indicating. Then it enters into the foramen magnum. You can see the base of the skull, and red arrow is indicating the foramen magnum. So two arteries from either side enters into and fuse together to form single vertebral artery. So this is the course, origin and termination of the vertebral artery. So this is, you can explain, the first part of the subclavian artery gives this branch from its convex surface, ascends through the foramen transversarium and starts from the cervical 6 up to the cervical 1, and then it passes above and posterior, arching over the posterior arch of the atlas, making a groove, then pierces the atlanto-occipital membrane and enters into the cranial cavity through foramen magnum. I hope you have all understood this important artery that supplies the brain. This is the vertebral artery. So in the neck, it gives a series of muscular branch and the spinal branch. This is the surface projection. You can see in the midline the thyroid cartilage. This is clinically very important to identify different structures. This elevation is known as Adam's apple. This is more prominent in male. So how can we get the arterial pulsation of common carotid as well as external carotid? So concentrate over this. The two fingers are below the level of the Adam's apple, because uh, uh, you see the upper border of the thyroid gland is above the uh, Adam's apple, and at that level the common carotid bifurcates, and there most likely the uh, carotid sinus is present. So during pulsation we used to move the finger, so the carotid sinus masses may unstable the blood pressure. That's why we used to pulsate below the carotid sinus. So we target the place, that index finger and the middle finger, just below the Adam's apple. Adam's apple already below the upper border of the thyroid cartilage, so that will be well below the carotid sinus. This way we can take the pulse of the common carotid artery. And here you have seen the surface projection of the common carotid artery. This is the Adam's apple. External carotid artery, to pulsate we should target well above the Adam's apple, up the middle finger above the level of the Adam's apple. It should be well above, because we should avoid the position of the carotid sinus we already described. In this way we can take the pulsation using 2 fingers, or we can use the 3 fingers also. We can take the pulse of own arteries, but we must be careful about the carotid sinus. Thank you very much for remaining with